Hello, everyone. My name is Dr. Susan Marra, and this is Dr. Marra's Medical Minutes. And today we're going to talk about Ehlers-Danlos syndrome and sort of the spectrum that encompasses. So Ehlers-Danlos syndrome is a genetic syndrome where there is a problem in the structure and processing of proteins that are involved in collagen production. And it's characterized by 13 different genetic disorders. And the one that I'm going to be talking about today is called Hypermobile EDS or hEDS. I happen to have that, so I'll show you what I mean by that. You'll see that I'm extremely bendable. You see my fingers, and you can see my thumb can touch very easily my wrist, and I can put my leg over my head. And I've always been very elastic, stretchy, like Gumby. And when I was growing up, nobody thought too much of this. But as time has progressed, and especially since about 2015 or 2016, there's been a lot more interest and awareness about Ehlers-Danlos syndrome because it's actually pretty common. Now, there's variations. So I am somebody who has the propensity for hypermobility, but I don't have a lot of the other stuff. I don't have joint pain. I don't have scoliosis. I don't have brittle cornea. I don't have a lot of the other things that go along with it. And that's what I'm trying to say, is that it's very genetically determined and then modified by environmental factors. So one of the things that we're beginning to understand about Ehlers-Danlos is that it is very influenced by the presence of histamine in the body. So, people who have allergic constitutions and have a lot of allergies, they are much more histamine reactive, and they produce much more histamine. And histamine is a generalized physiological response to the presence of allergens and antigens in the body. It's normal. It's just that when it becomes excessive, it becomes a problem. And histamine will make EDS, especially hypermobile EDS, worse. And so the connective tissue in the skin becomes very stretchy. And again, I'm somebody who has very stretchy skin as well. You can see this is all just part of it. And so it makes me a little bit more wrinkly than the average person because my connective tissue is loose and you can pull it. And the other thing that happens when you have hypermobile EDS is that you're much more prone to sprains, ankle sprains, things like that, of which I've had many. Just stepping off of a curb, I can twist my ankle because my ligaments are very loose. They're not stable, okay? And so you have more injuries that way. There's no known treatment right now for Ehlers-Danlos syndrome, and it's largely helped by physical therapy, and in particular, one type of therapy called strain counterstrain. And that has to do with the manipulation of fascia. And my good friend, Dr. Holly Christie, is a world expert in this, and she's right here in Poulsbo. So if you're interested in getting an evaluation for EDS, you can call my office, or you can go to the EDS Society and check in with them. And you can also see a geneticist to see if you have the genetics for it. Again, there's no treatment right now. It's a genetic disorder, and it seems to become more of a problem as you age. And I think as you have the effects of histamine on your collagen, histamine is very degrading to collagen, so it makes it even looser. So that's why histamine is not a friend of patients with EDS. So I hope you found this information useful, and I hope you have a wonderful day. Take care.